This video, I am again discussing one communications, that is a recall communications, coarctation of aorta or aortic stenosis. So first, it comes as a unit, like a case of collapse unit with probable diagnosis of coarctation of aorta, ventilated, started on dopamine, and arranged to be sent for urgent surgery. Task is counsel the parents regarding need for transport, surgery ICU. Mother was crying all the time, not listening. So it is really breaking bad news, also information giving, and mother was crying, so we'll offer a tissue, a glass of water, like that. We need to most empathize in this scenario. Next, same coarctation attack come like a teenager with severe chest pain and fainting attacks that occur twice, and recently intolerant to his usual sport activity. Task is counsel his parents about the possible diagnosis and management of the coarctation aorta or aortic stenosis. So we'll tell that what are the signs of coarctation aorta, how is it diagnosed, echo, how treated, admission, surgery. It come 2022. So coarctation of aorta. As usual, we start like introduce myself, making repo. I'll ask, taking the consent agenda. I'll tell, and there is attendance. I will ask about the prior knowledge. So how much you know about his, what is your update about his health condition? I will ask. Then suppose Ali, after examining Ali, we found that he have a condition. It is called coarctation of aorta. Did you heard about that? And he needs, so he heard about that. So he needs transfer to a tertiary hospital. So our agenda is we are here to transfer him to the tertiary hospitals. Then mother has maybe no idea about what is coarctation aorta. I will draw a pictures. Make it easy for you. Please follow. So we'll draw a picture about coarctation of aorta. Normally, our heart consists of four rooms. Two is upper receiving room and two is lower pumping, and two main blood tubes coming from it. So two upper four chamber, two upper room receiving and two is pumping, and two blood tubes coming from the side. Okay. So the right one carry the blue blood to the lungs called pulmonary artery, and the left one carry the pink blood to the other parts. So right one carry blue blood from the lung, and left one carry the pink blood from the other parts of the body. And while baby in the womb, there is a connection between the blood between the two tubes and close after the birth by some days. So during after birth, baby is the womb, there is a connection occurred between these two blood tubes, but that is become close after the birth. Here in Ali's condition, what happened? He has a narrowing in the major left blood tube called aorta. So when you draw the picture, this aorta left side the blood tube will giving some narrowing. So there is a narrowing of the blood tubes on the left side, that is aorta. This narrowing after giving the branches of the upper part of the body, and this explains the high blood pressure in the upper limb and low perfusion in the lower limb. So it has branches, upper part and lower part. Upper part it gives more, that's blood pressure is high, but lower part there is low perfusions. So lower limb, low blood pressure. Am I clear? So this is the explanation. We will tell that heart has four chamber, two is upper receiving and two is lower pumping, and right side there is a blood tube, left side there is a blood tube, two blood tubes. So right side carry the pink blood from the lungs, pulmonary artery, and left side carry the right side carry the blue blood, and left side carry the pink blood from the other parts of the body. And before birth, what happened during home? If PDA they are telling, then we'll tell this explanation. Before birth, there is a connection between the PDA, but after birth, that is cut down. What happened? The left side of the branch, which called aorta, where there is a narrowing in Alice condition, narrowing occur. For that reason, it has two branches, upper part and lower part of this aorta. And upper part there is a big going blood, that's why blood pressure is high. But lower part that is narrowing, so low perfusion and low blood pressure. That's why there is a blood pressure problem, upper part and lower part. So why it appear late, doctor? It appear when the connections I mentioned close after birth, dark dependent. Why it appear? Maybe it was not that much severe. That's why, or he was doing exercise. He's a child. They will tell that why not appear. So maybe he's doing exercise or playing. That time body needs much more blood transfusions or pumping the heart much more. That's why he become fainted or chest pain occurred. So steps of the management. Management, they ask any cardiac will involve the heart doctor. Soon we are arranging a meeting with the heart doctor. Then he will explain it nicely. So what are the first we medication given? First we stable him, keep the connection open to stabilize him. Then the surgery shortly after birth. That will explained by the heart doctor. So summary leaflet support group, as usual we will tell that And some question like my other child can be affected. Actually, it is not running in the gene, but there is a increase the chance of a family member. So screening will be good. Like that, will that is there any fault of mine? No, there is no any fault of you. Like this question, they can be asked. So this is all about the recall, communication, coactation of aorta or aortic stenosis. It comes as a teenager who fainted and chest pain suddenly and discovered. And another is Munich, who has referred to the tertiary hospital. So we'll tell the agenda at the beginning that my agenda is I am transferring him tertiary hospital. This is all about these communications. Thank you.